And right now at 6, a push for mental health resources in our children's schools. Districts say they have called for more money in that sector, but in the past, North Carolina's General Assembly has been unmoved by those calls.
That's right. Local education leaders say that the lack of funding has resulted in shorting schools on critical school counselors, psychologists. But this could change after that school shooting in Uvalde, Texas. WCNC Charlotte's Shamaria Morrison joining us live with those details. So Shay, we've seen school districts nationwide experiencing mass shootings prior to Uvalde, of course. So what is different now?
Well, I think it's a mix of that public and that political pressure that they're feeling on the state level to do something so they can prevent something like what happened in Texas from happening at a school here in this state. But let me tell you, it has been a fight on the local level to get any such funding for mental health resources. CMS has tried many times, even back in 2018 after the Parkland shooting in Florida, but not much has really changed on that front.
Review of what we did earlier.
School districts have long asked for help funding mental health services. COVID-19 funds temporarily filled that financial gap.
This big influx of COVID relief funds that we've had expires in 2024.
That means funding for mental health programs or staff members that went with it goes too.
Unless we can show either the state or the county that these investments are worthwhile, and please, replace those funds when they disappear to keep it going.
There's an appetite for this in Raleigh. Some lawmakers say it could stop the next school shooter.
It's a mental health aspect of helping those kids that maybe think about harming themselves or harming others through proper threat assessment, communication of everyone that comes in contact with those students. I think that's the key.
The chair of the North Carolina House Education Committee says schools need to have the tools to intervene.
I think there's room for more. It will always be something that we focus on. I hope we get to the point where we don't have to spend a nickel for school safety, that society corrects itself.
CMS has put in body scanners to detect dangerous weapons, but it's only half the battle.
And the other thing is preventive measures with teaching, checking in on students with their social emotional health, teaching safe and healthy conflict resolution tactics.
More funding for mental health services can pay for dedicated spaces for students to process stress and grief, and someone to talk about it with. And any movement that's going to happen with additional funding for mental health likely won't happen until the next school year, also when they go into the long session. But in the short session that just wrapped up, they actually did give more money to some school districts to hire additional student resource officers. Live at CMS, Shamaria Morrison, WCNC Charlotte.
Shay, thank you.